Good afternoon, good evening. Thank you so much for joining us for the Africa CDC Mpox weekly briefing. My name is Margaret Edwin, the Director of Communications. I will be moderating this session. Today, our main speaker is Dr. Ngashi Ngongo, the head of Incident Management Support Team, joining us from Burundi. I will now hand it over to Dr. Ngashi to start the session. Over to you, Dr. Ngashi.
Thank you very much, Director. Good morning, good afternoon, good night to everyone, depending on which part of the world you are in. First of all, let me just start by presenting the apologies from the Director General, who is currently traveling and couldn't be with us today to take the call. And also, let me thank all of you again for making the time to meet with us to get this update on the situation of Mpox on the African continent following the declaration of Mpox as a public health emergency of continental security in August last year. But just to say that this is also happening at the time we are now also dealing with Marburg in Tanzania. I think many of you might have heard the announcement by the head of state. Again, to reiterate that the number of public health events and outbreak is increasing every single year. We had 166 events in 2023. And we registered 214 in 2024. That means that really outbreaks have become part of our daily work. We are very happy to have you again to get this update from us. Thanks, Director. And perhaps, I don't know if we can move into the actual presentation. Thank you. Yeah, let me just start first by presenting the epidemiological situation of the first 2 weeks of the year 2025. A total number of notified cases of 5,842, of which 669 confirmed cases. I think the DRC data not yet included. We are still waiting from the country as they were cleaning up the data. As soon as they submit to us, we are going to update that, most likely for next week's press conference. We've had, among all notified cases, 38 deaths, and among confirmed cases, 4 deaths, all of them that came from Uganda. Now, as of now, we've made a total of 21 AU member states that are being affected by Mpox. But recently, we have about 10 member states that are actively reporting cases of Mpox. The situation has remained almost dominated by Central Africa, which account for 88.7% of all suspected cases and almost 90% of all deaths that have been reported. But when we look at the situation in AP week 2, we had confirmed cases 367 that came from the 3,171 suspected cases, and the number of deaths among all cases at 90. Next slide. Now, during the second week of 2025, I think there were 5 countries that reported 367 cases that we spoke about. That's Uganda, Burundi, Central African Republic, Nigeria, and Sierra Leone. Just to say that we are still waiting for data from the DRC. Sierra Leone, as we reported already last time, had registered its first case on 10th of January. As of the second AP week, I think they have now 12 confirmed cases that have been reported. And the sequencing of the first 2 cases showed that they were dealing with clade 2B. Across the continent, as I said, 10 countries that are in active phase of the outbreak. But most importantly, if you remember that last time we mentioned that there were 8 countries that were in control phase. Now there are new countries that have also entered the control phase. That's Angola, Guinea, and Liberia. And with that, we have reached now 11 countries that are in control phase and the 10 that remain in active case. And as we also said, that the good news is that there are about 4 countries that have exceeded the 90 days with no confirmed case reported from those countries, which are South Africa, Gabon, Morocco, and Zimbabwe. Next. Now, when we look at the epi curves of category 1 countries, which is the highest risk countries, we are seeing some pattern when we put together the year from epi week 1 of 2024 up to epi week 2 of 2025. We are seeing some interesting pattern. There are countries like Burundi that we are seeing a certain level of stabilization. I think we see the plateau over the last a couple of weeks. At the same time, there are also a set of countries that we see the upward trend. I think like in Uganda, where we're still registering an increase in the number of cases. Next. Now, when we look at the situation in the DRC, I think we try to zoom in into the hotspot as we are now thinking about the acceleration of the response over the last part of the continental plan, which is January and February. In the DRC, for example, there are 3 provinces that account for 91% of all confirmed cases. I think those provinces are really the context of high population density. It's also where we have the usual problem of access to health services, which is 2 challenges, and also high travel and trade, in those provinces. Just to say that as we move forward, I think there will be some intensification of the response in the provinces that are the most affected, to ensure that surveillance is strengthened, laboratory is decentralized, and that infection prevention and control is also scaled up. Vaccination is also accelerated to ensure that we can really see toward the end of February, beginning of March, some good trend, that is some stabilization, if not the beginning of the control of the situation. Next. We did the same exercise in Burundi where we are right now, just to say that we completed the interaction review in December, where we had an opportunity to take stock of some of the lessons that we are drawing from the first part of the continental plan, what has succeeded, what has not succeeded, and how best we can really manage the second phase to accelerate the progress. Burundi and Uganda are the 2 countries that did not conduct at the time because they were not ready. This week, we are privileged to be here in Gitega in Burundi, also with Her Excellency, the Minister of Health, that is here full time with us, that's involved in the review, in the interaction review. The same picture, we have about 7 districts in Burundi that account for 85% of all confirmed cases in the country, of which 3 districts are in Bujumbura, the capital city, in the municipality of Bujumbura, there where we have 57.8% of all cases, and also North Bujumbura, which is the most affected district among them, which account for on its own for 38.2%. I think those are the places that we like to see the intensification and acceleration of the response. Next. In Uganda, we also found a similar pattern. Fewer districts that account for the vast majority of confirmed cases. It's a seven districts in Uganda, I think, that account for the vast majority of these cases. They just to say that 3 of them, that's Kampala, Nakasongola, and Mbarara, have the highest attack rate, as you can see, ranging from 13 cases out of 100,000 population in Mbarara to 55 in Kampala. Next. In Sierra Leone, that I just also spoke about at the beginning, we have now reached about 12 confirmed cases that come from 7 districts. But the good news is that Sierra Leone is doing quite well, learning from the challenges of the other countries on the surveillance, the listing and monitoring of contact is something that is really accelerated, with an average around 20 contacts per confirmed case, which is what it's really expected. And 206 of the 236 contacts are being monitored. On the suspected cases, I think out of the 82, 77 have been tested. And for those that the two that they did the sequencing at the beginning, as I said, is clade 2B. There are some challenges in the country. The most important one, which is the limited financing to support the Mpox response, but also the availability of reagent and test kits. And then the Mpox vaccine, I think it is not yet in the country. Next. Now, on the laboratory testing, I think we are observing a very good pattern to say that at least for the second phase, this is a very encouraging development that testing overall is around 90% and above, except in one single country, which is the DRC. I think that's why you saw last time when the Director General of Africa, CDC, handed over the laboratory equipment for the decentralization of laboratory to the head of state. It was in response to the fact that not only DRC is the epicenter, but at the same time also DRC has the lowest testing coverage in the Mpox response. I think the country is being supported in that particular area to make sure that the testing is decentralized and also the turnaround of results is shortened so that people are not exposed for a long time with suspected cases while waiting for the result to be to return to be given and the case management to be started. Next. Also wanted to say before we finish that on the vaccination front, we do have now 4 countries that are vaccinating. I think the latest is Central African Republic that has now launched also the vaccination. As you can see on the picture there, His Excellency the Minister of Health administering himself the Mpox vaccine. The launch was on all the partners, WHO, UNICEF, the Red Cross, Gavi are all supporting the rollout of the vaccination in the country. I think they just started. I think they had more than 20 people that were vaccinated, at the launch. We are still waiting for the report to know now how far they have reached. In summary, on the Mpox, 21 countries are affected, 11 that have entered in the control phase. I think that's progress in the right direction. As you also say that we still see an upward trend in some countries like Uganda, but the plateauing in countries like Burundi, which are some of the most affected, is also an element that is giving us a lot of hope. I think there is also, during this phase of intensification, I think the concentration in some of the cities like Bujumbura, Kampala, Kinshasa, where we're seeing really the high numbers of Mpox is one of the priorities among the hotspots that have been identified for this phase of the acceleration. But it's also important to say that, as we reported last time, that we'll be moving more toward an integrated response. We had before a country like DRC where we saw some of the other outbreaks that were concomitant with Mpox like measles. And now we are also seeing Marburg in countries like Tanzania And even here where we are, we had a meeting with the Minister of Health this morning talking about the preparedness, of Burundi for Marburg. And next week, there'll be another team that will be moving also to Uganda to discuss not only the interaction review, but also the preparedness. I think that kind of leads us toward more integrated response that also address some of the common challenges important to address these emergencies that emerge. Next. Just also a few words on the Marburg situation in Tanzania. As you know, on the 20th, Her Excellency, the President of Tanzania, declared the Marburg outbreak. What we know so far is that there have been 10 cases that have been notified, of which 9 have already died, which really reflect the very high case fatality of Marburg. Now, so that you can then understand also the quality of the response in Rwanda, where we had a case fatality rate, around 22%. We deployed a team already in Tanzania since 2 days ago. The people that supported the Rwanda response, they're already in Tanzania right now, and we are doing everything we can with WHO and all the partners to, as much as possible, try to emulate some of the progress that were made in Rwanda, building on those experiences. I think the teams are already on the ground. The cases are mainly in the Kagera region. If you remember, the same region that also reported an outbreak of Marburg in 2023. It's a region that borders 3 countries, Burundi, Rwanda, and Uganda. I think Rwanda has just come out of the Marburg outbreak. I think the level of preparedness is very high. We are in Burundi also. We've discussed that, and very soon we'll also ensure that the country strengthen the surveillance, strengthens the laboratory testing capacity. There'll be, and that the case management will also strengthen with centers that are identified, as well as the infection prevention and control. I think there have been a total of 31 tests that have been conducted, 2 confirmed, and 29, I think, that are negative. Now, the response has also been thought through. There's the National Response Plan of Tanzania has been developed with a budget estimated at $10.8 million, I think, to help the country. That will be focusing on really strengthening the key pillars of the response around surveillance, around laboratory testing, around risk communication and community engagement, around IPC and case management. And the surveillance is already being stepped up, and the contacts have been already listed. Of those 10 cases that I've just spoke about 281 contacts have been listed and are being followed. There to show that if you look at the average, it's about 28 contacts per case, which is very good. It really shows that this level of contact monitoring is critical to control the chain of transmission. Next. And finally is on cholera, the situation of cholera in Angola. As you know, that the Minister of Health declared a cholera outbreak on the 8th of January 2025. 708 cases that have been notified, of which 104 confirmed and 604 suspected. The case fatality is quite high, 4.5%. And there are 5 provinces that are affected: the province of Bengo, Wambo, Ikole, Luanda, and Malanje. And the profile of the people that are affected, I think females make 52%. And on the age group, I think half of them, the affected people are below the age of 20 years. I think there are some challenges related to the heavy rains. I think with the risk of flooding and also the delays in care seeking. I think those are some of the challenges, but we're already working with the government, and we've even identified cholera vaccines. I think that are most likely, if all goes well, with the supplies going to be deployed to Angola next week. I think the response is on. I think we are there working with the government of Angola very closely to make sure that this outbreak also gets under control. I think that's the end of this presentation. I would like to thank you for your attention, and back to you, Director.
Thank you, Dr. Ngashi. Let's take the first two questions from the chat room. So the first question from Nadine Dreyer, the health editor of Conversation Africa. The question is, how far is the rollout of Mpox vaccines in Kinshasa? That's the first question. And then Eva from German Press Agency asks, Marburg outbreak in Tanzania, how many more cases have been confirmed, and what are the updates on contacts or countermeasures? You can take the first two, Dr. Ngashi. Over to you.
Yes, thank you very much, Director. On the vaccination in Kinshasa, I think we've seen some good progress. You remember, we had reported in December that we were at 55,000. And the last 4 weeks, most of the vaccination has taken place in Kinshasa. They have moved to reach almost 180,000 tested, vaccinated. That means that's about 125,000 more, I think, that have been added. Right now, the government is finalizing the revised vaccination plan. And Kinshasa is one of the hotspots. I think that is going to be also accelerated. The vaccination is already ongoing in Kinshasa. It continues, but only that the assessment found some weaknesses in terms of the target population and the approach, especially in the very hotspot like in Pakajuma area, where there's really crowding and sex and all those risk factors that are going. They're now revising the strategies to make sure that in those crowded places where it is very difficult to single out the few contacts, they're going to vaccinate almost everyone in those high risk locations. And also, they're going to make vaccination on daily basis, I think, which was not regular. I think that's one of the reasons also they saw that they were moving much slowly. I think that strategy should be out this week. We are hoping. They were just crunching the numbers to also let us know what is the now new target population in terms of the number of people that they would like to vaccinate, for us to help also look at the vaccine availability, if they'll be able to cover the population that they intend to. In Marburg, you remember when the declaration went out, it was based on one case that was confirmed. But since this morning, we got a report that there's a second case, I think, that has been confirmed. That's how we spoke about 2 cases. And in terms of the medical countermeasures, in Rwanda, we had the opportunity at the request of the government of Rwanda to also use an antiviral. I think that was provided, as well as the vaccine, on more compassionate use. I think it is the same that is also being considered for Tanzania, but all that to be clarified once the government has finalized and also requested the support that they need from Africa CDC and all the other partners. I think we'll be able to provide the same package that was also provided in Rwanda. Over to you, Director.
Thank you, Dr. Ngashi. Let's take the next 2 questions. Kerry from Health Policy Watch, you have the floor.
Thank you, Margaret. I just first wanted clarity on the stats. The 5842 new cases, does that exclude the DRC's cases? And then my main question is, what is driving Mpox in Uganda? I remember the early report was that it had been identified in prisoners, then there was a mention of fishing communities. So I wondered whether you could just maybe spell out where it is and what kinds of groups in Uganda. Thank you very much.
Thank you. Let's take the next one before Dr. Ngashi comes in. That's Janice from Bloomberg. You have the floor.
Afternoon. Thanks again. I just wanted to ask for a response from Africa CDC to the news that President Trump is planning to withdraw from the WHO. And obviously, there are a lot of programs in Africa that have been funded by the US, PEPFAR being a notable one. I just looking for a response to that. Thank you.
Over to you, Dr. Ngashi.
Thank you very much, Director. I don't know, is Dr. Merawi, are you connected?
Yes, I'm here.
Yeah, please, if you can take the first question on Uganda.
All right, thank you very much, and good afternoon, good morning, all. So regarding the 5842 suspected cases, that includes the DRC as well. The only thing that is remaining is confirmed cases that we are still waiting from the DRC. Yes, with regard to Uganda, the drivers, I think this has been frequently mentioned since its introduction into the country. That was followed by this truck drivers, and then it went into congregate settings. Then it is now moving into the community. Maybe some of the associated factors, including sex workers and so on, are main drivers now for the Uganda. Thank you.
Yes, thank you very much, Dr. Merawi. Now, on the question about some of the decisions I think that have made by President Trump on WHO, on PEPFAR, I think we have to say that these decisions are of great importance to Africa and to WHO and to all our organizations, like Africa CDC, given the fact that we all know the weight of the US government when it comes to the funding of public health in Africa. I say they are one of the main contributors of public health. In Africa, PEPFAR has been funding HIV programs in many countries that have very much relied on the American investment really to advance these programs where they've reached. Now, the reduction or the cutting of that funding is definitely going to affect the response in many of our member states. And of course, as one can also imagine, I think the same with WHO. And we also know the role that WHO has played on the continent to provide the technical assistance to the member state to really improve the delivery of health programs on the continent. I think it is something that has to be discussed. I think all of us, the member state, will have now to get together quite fast and reflect on that and say, okay, what are the consequences of those decisions? And also think about some of the mitigation measures. That goes just to say that it is time really just thinking, looking forward, that it is time for some of the African member states to rethink the financing of public health on the continent. That was already the push through the Sustainable Development Goals, the important role of domestic financing when it comes to the sustainability of many of these programs. I think that's exactly the point that we are getting into. As you know, that Africa CDC has been pushing, I think, over the last two years, the establishment of this Africa Epidemic Fund. But in addition to that, is also pushing some of the innovation. There will be the meeting of the head of state, which is planned in Addis in February. But on the 14th, you've said that Africa CDC with President Kagame we are organizing an event on health financing. It was already anticipated. It wasn't really made for this for the decision that have been made, but it also along the vision of Africa CDC to also try to see how we can really push toward more sustainable, predictable financing of public health that come from domestic resources. And I hope that as we move forward, these are the solutions that we need to rethink and But this time, how we can accelerate them as an alternative also to build some resilience, on decisions like so that all these programs do not just collapse, but there is an alternative funding source that can step in and sustain these programs over time. Over to you, Director.
Thank you. Oh, let's take the next two questions. Sarah Javing from DVEX, you have the floor.
There has been some communication from the Tanzanian president around 25 suspected cases of Marburg, but that they tested negative. Can you clarify what that means? Are there some challenges around the quality of the test samples? Thank you.
Let's take the next one. Paul from the Lancet, you have the floor.
Hi, thank you very much. So I would like to know what the situation is regarding the vaccination and Mpox case count in Nigeria, and pushing back a little bit on the question on financing as far as the US government is concerned. I'd like to know how Africa CDC itself is directly impacted, and what kinds of direct relationship in terms of support and financing that Africa CDC has on the US government. Thank you very much.
Thank you. Dr. Ngashi, over to you.
Yes, thank you very much, Sarah, for the question on Tanzania. I think there were 25 suspected cases. The result that we got this morning is that they have run 31 tests. Out of those 31 tests in total, I think 29 of them have been negative. There's only 2 that have been confirmed positive. It most likely, I think those 25 might be part of those that are being tested, I think that have been reported now. What we haven't yet received the information is whether all the 25 have been tested and confirmed negative. That we don't know. I think we just have to see, because if you take the 10 cases that were already there plus 25 suspected, that's over 30, over 35 cases that we are talking about here. But the total number of tests run up to now is only 31. That means that there are still some of those that either they haven't been tested or the tests have been run, but they are not yet communicated. Now, we hope that once we get the full picture, we'll be able to come back to you. The question about the President Trump's decision and how that affects Africa CDC, I would say that, at Africa CDC, there's one way that we look at public health financing. We look at first what comes to us as an organization, Africa CDC, and also what goes to the figures that we present today are not the figures for Africa CDC, are the figures for Africa CDC as well as the support to the member state. As I said, it is going to affect big time the member state for sure, but Africa CDC as an organization, not very much, because we are still, for the last 1 year, we are in the process of developing our joint action plan with the US government, I think, to then bring together the support that different US agencies would bring to Africa CDC. We're in the process of doing that. But I think there is also funding from here, from US CDC, that supports certain element of our work, but it's not the big funding of Africa CDC for now. It's less than 10%. I think just to say that when you come to us, we don't really expect that much impact. But what we can also be worried about is this current discussion of the new joint action plan, that we're also counting much bigger support from the US government, that might be affected if this decision goes ahead as it has been announced, that we might then need to lower a little bit of our expectation, the way they have been raised over the months that we've been discussing with the US government. Now, Gift, I don't know if you are there to answer the question on vaccination in Nigeria. Gift, are you connected?
I don't think he's connected.
Yeah, I think no. In general, Nigeria did not get that many cases. I think so to say, if of Mpox, and the ring vaccination that they have applied. I think vaccinating around the cases has also not required too many people. As we say, if you look at the average of up to 20 contact that are expected from an index case, the numbers that they are reporting are also reflective of the sporadic nature, of the cases that Nigeria has been reporting. Most of it suspected to be of zoonotic origin. Vaccination continues. As you know, Nigeria had received the first 10,000 doses, and then Nigeria was also eligible for the second allocation. I think they don't have any problem with the availability of the doses. I think the only problem is to make sure that as they receive the doses, they also have funds for the operational cost. I think that's what we know. But really, where we have most of the worries, it is the new countries that were allocated, but they haven't completed the process of receiving all the vaccines. And of the 3 countries that were vaccinating, Rwanda, Nigeria, and DRC, it is more the DRC that had more challenges of having the vaccines that the performance on the ground was not reassuring that they can absorb until we saw now the recent changes in the trend toward acceleration. I think that's where we are. I wish Gift was there to give more details on that question. Over to you, Director.
Thank you. Let's take the next 2 questions from the chat group. So Christina Okello from Radio France International is asking, how many Mpox vaccines have been distributed across Africa and which countries have received them? That's the first one. And then the second one, on a scale of 1 to 10, how would you rate the severity of the Mpox situation in Africa? Let's take the last one before you come in. So we have Emmanuel from Japan Broadcasting Corporation. He's asking, what is the status of vaccination efforts against Mpox in affected regions, and how many doses have been distributed so far? Over to you.
Yes, thank you very much, Director. I think the number of doses distributed so far are around 400,000 doses distributed in DRC, in Nigeria, in Rwanda, now recently in Central African Republic, and in Uganda. I think those are the 5 countries that have received the vaccines, around 400,000 doses, 4 that have already are now vaccinating, and Uganda, which is to start because they just received the vaccines before yesterday. That's where we are now. The second question about the severity. I think the severity of Mpox on the continent is reflected by the double declaration of Africa CDC and WHO, which that just tells that it is severe enough, not only severe, but also the impact of the spillover to other countries and also to the world that justified the double declaration by Africa CDC and WHO. Now, where do we stand now? Be a bit patient because the WHO advisory group will be meeting very soon to revise, to review the situation and then advise on the lifting or not of Mpox as a public health emergency of international concern. And the same thing will be also happening to on this Africa CDC side. We communicated 2 days ago with the emergency consultative group also to also rethink and also advise on what needs to be done. And most importantly, is this question is at what point do we need to lift up the declaration of public health emergency? Or that is something the 2 groups are working on it. I think in the next 1 week or so, we should hear from them and we'll communicate that.
Thank you. Let's take the next two questions. So we have Kate Lay from The Guardian. He asks, just to clarify about the patients in Tanzania whose tests for Marburg have been negative. How likely is this to be true? Is this true negatives, or is the testing not reliable enough to say that with confidence? And then the next question is an additional question from Janice of Bloomberg. Has Africa CDC seen willingness from other countries like China or the Asian or Middle Eastern countries in stepping up to fill the gap left by the US? Over to you, Dr. Ngashi.
Yes, thank you very much, Director. Yeah, I think the results are being conducted in the National Public Health Laboratory in Dar es Salaam. I think which confirms that it is the highest laboratory in the country. We trust the result. As you know that Tanzania is one of the countries that Africa CDC has really supported in terms of capacity development, infrastructure, upgrading, the upgrading of equipment and the distribution of even the sequencing machines. I think it's one of the countries that has really been supported. The capacity is quite high in that country. We tend to believe the reliability of the result. Now, on the second question about the other countries, if we are considering that they might step up to help us fill the gap, I think there have been really willingness over the past. You can see we've received support from many countries, from Korea, from China, from many other countries, from Japan, that have really come forward to also provide funding, either the cash or equipment, to support the response. I think with the gaps, once we've taken stock of the situation and how that is going to affect us, I think we'll be exploring the opportunities of also broadening, I think, the resource mobilization toward those other countries that are really willing to step in. But let me just say something, that at least for the commitment that the US government has already had made on Mpox of funding 500 million to support the Mpox response. If you saw our financial tracker, the US had already dispersed around 314 million already in the Mpox through different channels. That says that the situation as it is now, it looks not bad, although we are just trying to work with them to get more details, because we also want the financial tracker to even identify how much went to which country to support which pillar of the response. But overall, I think the response so far has been good. Now, moving into the future, if one door closes, it is natural to explore other doors to continue the response as it is. And especially it doesn't stop here. We have now Marburg also opening. It's another outbreak that is opening. We spoke about cholera. With all those, I think we'll have no option than continue exploring other well-intentioned countries that can come to the rescue of African member states.
Thank you. Let's take the next two questions. So this one asks a follow-up question on Mpox in Uganda. Are fishermen being affected? And if yes, what are the measures being taken to counter the spread of the disease among neighboring countries, especially Kenya? That's the first one. And then the second one asks, what is the level of IPC intervention in the Mpox epidemic in DRC, particularly in rural areas? Over to you.
Okay, thank you very much for those questions. I think, as you know, that the Kenyan case at the beginning came from a truck driver that moved from Uganda to Kenya. And as a result of that, Kenya has stepped up point of entry surveillance, especially cross-border surveillance. Those are the measures, I think, among those that have been strengthened to really improve the response. Uganda itself, as I said, will be going through the interaction review next week. The Continental Incident Management Support Team will be involved in that. But the response that has been implemented so far from the Uganda side has really been a comprehensive response with surveillance, with laboratory. If you see the testing in Uganda is almost 100%, with infection prevention and control, with risk communication and community engagement, and with case management. I think all those have been, but the only element that was missing in the package of interventions on the Uganda side was vaccination. Now they have received vaccines, and with the introduction of that, they have really a comprehensive package. Now the interaction review will then look at, okay, what lessons can we learn? How can we do better? To make sure that we have a much broader reach of these interventions to see the control of the epidemic that we are looking for. On the Kenyan side, the same thing. Kenya has also mounted similar response because all the member states were aligned with the recommendations of the continental Mpox response plan. I think that outlined those key pillars of the response. As I said, the surveillance has been going on in Kenya, both the strengthened at port of entry, but also the community-based surveillance has also been going on. The laboratory in Kenya is also good. It's 100% testing rate in Kenya. The risk communication is also going on. I think the only element that is left now for Kenya, like Uganda, that has moved fast is vaccination. As you know, Kenya has got already an allocation, and we have already received the feedback. It is just now that we are preparing for the deployment of those vaccines in Kenya. I think that's what I can say. And then the question on IPC in the DRC, I don't know, Andy, if I can ask you to respond to that. You can come and use this one.
Yeah, thank you for the question. In fact, in the rural areas of DRC and after the interaction review, it has been noticed that there is a number of challenges, including the level of training in IPC for the healthcare workers, but also the stock out in terms of personal protective equipment. And that's where actually WHO and Africa CDC as the joint IMST, we're trying to address those challenges, including by training. Especially for Kinshasa, like the Pakajuma area, where we have 50% of the cases in Kinshasa, we've been able to implement the training and capacitate more than 100 healthcare workers, but also the community side, more than 45 community health workers and 30 leaders, community leaders. So it's really a comprehensive package going from building capacity at the level of the knowledge and then providing the resources and of course monitoring the practices at that level, both healthcare facilities and community level. Thank you.
Over to you, Director.
Thank you very much. Let's take the next two questions. So Priyanka, a science journalist, asks, could you please update on the next steps in regards to the outbreak in Kagera region? So contact tracing and testing for Marburg in Kagera. So what is the next step there? And then the last question is coming from Majid from GIOPID Radio. So what lessons were learned from the previous Marburg outbreaks that are being applied to the current response in Tanzania? And how is the Africa CDC supporting capacity building for local healthcare systems? Over to you, Dr. Nga.
Okay, thank you very much, Director. On the question about how we are responding in Tanzania, as I said, the first thing that we've done is to deploy a senior team. They made of the same senior experts that were deployed in Rwanda within 24 hours of the declaration to help Rwanda mount the response. We really wanted to build on that experience, the experience of Rwanda, of all the best practices, to also get the same people that were involved with Rwanda to go to Tanzania and build in the response. I think the lessons that come from the Rwanda experience. As I said, we now have a national response plan of Tanzania that captures most of those experiences, and the team is on the ground, and the role was to help them design the response. In addition to that, as we did in Rwanda, we are also deploying a team of experts on the ground to support the different pillars of the response. In the team we are deploying, we have epidemiologists that will support the surveillance pillar. We have laboratory specialists, even in the advanced team right now, that are working on really the decentralization of the laboratory, with mobile laboratory toward, in the Kagera region. We have also experts in IPC, infection prevention and control, and in communication. I think that are part of that implementation team. I think that is going to be deployed rapidly by next week to also join the advanced team in Tanzania, in really providing that technical assistance on the ground, in the affected district for the response. To do mainly three things. One, to look at the issue of knowledge. I think that's why we are talking about the training. To look at the supplies, I think, that are needed both for the infection prevention and control for the case management, and also to look at the actual practices, in the case management, in the hygiene practices and so on. I think that's the second area. And the third most important area that I also mentioned is in the area of funding. I think what we are doing is to really coordinate with different partners to see how we can help the Tanzanian government mobilize funding in support of the 10 million plan that they have come up with. I think that is something extremely important. And another very important area of support is to get them the medical countermeasures. As I said, we are already in contact with the same partners that worked with us to support the Rwanda government. They are working with us right now. They have already also approved the donation of the drug, I think the antiviral for treatment, also the donation of the vaccine. But now what we are working with the government is for the government to then also make an official request for us to see how we can move. And just to say that really what we've learned in Rwanda is that we really need the leadership to be mobilized right from the start. That made the difference. You saw the way it was managed in Rwanda, with the minister coming, on every press conference, really talking about and also communicating on a regular basis where the needs are, how we can really adapt the support even to the progress in the response. That is something that is really critical. And there are also the coordination. I think that was very key to make sure that there's complementarity among all the partners, and the data, I think, which was critical, because good data also tells you exactly how the response is moving. And finally, there are specific best practices related to different areas of work in surveillance. What are some of the best practices? As you said, you saw the contact tracing in Rwanda was amazing, that at some point the minister could say that now we are getting all the cases out of the contact list, which gives us some assurance that we have the chain of transmission under control. They are the same that we can already see in Tanzania, how we have started in Tanzania. Look at the number of contacts, for those cases. As I said, an average of 20. That shows that some of those best practices, we see them again coming out of Tanzania as well. I think that's the support that we are providing, and we'll keep on updating that support as the situation also evolves on the ground. Over to you, Director.
Thank you, Dr. Ngashi. And with that, we have come to the end of our weekly press briefing this week. I will now hand it over to Dr. Ngashi for his last closing remarks. Over to you, Dr. Ngashi.
Yeah, thank you very much, Director. Let me thank all the participants for this sustained interest, really, to the work we are doing on the continent. And I'm talking here on behalf of the Continental Incident Management Support Team. that brings not only Africa CDC, but also WHO and all the partners that have decided to work together through this unified approach. These meetings are a great motivation for us really to continue doing this work. And also these exchanges that we get with you, beyond just the questions that you're asking, are also an eye-opener on some of the areas that we need to provide to pay more attention. We are grateful for this and will continue really updating on this. We are working together on the new situation on the Marburg situation that has come in. We are now supporting already countries, just learning from the initial experience with Rwanda that we have now Tanzania that has come up. We are just anticipating so that we don't get another country again around the initial site that also develop Marburg. That's the reason why we have now teams that are positioned here in Rwanda, in Burundi this week, and then another team in Uganda next week. I think it is with great pleasure that we'll continue really interacting with you, and we count on your support as well. We are going through very difficult time. There are many challenges, I think, that are coming our way, and we really we are open to also listen to you in terms of how much support we can also take. You are journalists. I think you also have an audience out there as we are trying to leverage more resources to support these countries. I think your voice also adding to our voice and also taking what we are reporting to you as the progress that we can also share out there to mobilize more support and more commitment to this response is something that we very much appreciate. I think with that, I would like to see you next week at the same time for our usual conference. Thank you very much to you too, Director.